Hey guys, in case you're wondering how to present a patient to a nurse or a doctor at the hospital, in this video I'm going to explain to you the way I do it. First and foremost, what I would like to say is, don't let them intimidate you. Don't feel intimidated. They're human, just like you, and no one knows it all. Just because they're a nurse or a doctor doesn't mean that they know everything there is to know about medicine. No one does. So if you don't know everything, or you don't feel 100% comfortable, obviously that's not ideal. I urge you to stay on top of your things and know your stuff. But at the same time, be realistic and understand that not everyone knows everything. Now that we got that out the way, the best way to communicate to a nurse or a doctor and give report, quote unquote, during triage or during a notification is you tell them what you saw on scene that's pertaining to their mechanism of injury or nature of illness. So if you saw empty bottles, you can mention that. Mention the diagnoses that are relevant to why you're there with this patient. So for example, if they have CHF, congestive heart failure, and they're at the hospital for pulmonary edema, then that's something important that you got to mention. So after you mention what's on scene, what you saw on scene, how the patient presented, and their pertinent medical history, if any, then you mention the treatment that you rendered to this patient. You mention whether or not there was a positive or negative reaction to this treatment. And after that, in some cases, like in a cardiac arrest, they're going to want to know the time frame, or in the majority of calls, they want to know the time frame. But in general, you tell them what happened, what you saw, information that's pertaining to the current situation, and a time frame. There's other instances like trauma. They want to know if they had a helmet, if they had a seatbelt, a medical cause or overdose, on what medication, which medication, did you bring the vial? So each patient presentation is unique and should be catered to that patient. But in general, you use this video and it should be able to help. Alright guys, if you have any questions, feel free to ask, feel free to comment, like, subscribe, and if you want to get a hold of me for some one-on-one coaching, my email is down below. Feel free to reach out. I got you. Alright, I hope this helps. Peace.